Everyone. In this video, we are going to continue our discussion of the major blood vessels of the body, and we are going to follow the venous side this time. So in part A of these blood vessel videos, we talked about all of the major arteries, and now we're going to follow the other side back towards the heart. So when we talk about veins, we're going to describe them as draining an area and then draining into each other. And keep in mind, when you follow a pathway of arteries, you're moving away from the heart. When you follow the pathway of blood in the venous system, you're following it back towards the heart because that's the way the blood is flowing, okay? So we're going to start right where we kind of ended off with the arterial side, and that's in the lower limb. Now, in the lower limb, you're going to see that we have some superficial veins, so veins very close to the surface, and those are going to be the veins that you see through your skin. And then you also have some deeper veins. So we're going to start with the deep veins because those are the easy ones. So the deep veins are actually identical to the arteries. Easy. So if we start, let's start over here with the medial and lateral plantar veins. So medial and lateral plantar veins are going to drain into the posterior tibial veins, sorry, which is right back here. Okay, so following the arteries. We also have a fibular vein over here, which follows the artery, and that connects back here with the posterior tibial vein, okay? As we move up, that posterior tibial vein connects to the anterior tibial vein. And we'll go back over here and catch up with anterior tibial. Here's anterior tibial. Here it is on the front. Okay, so anterior tibial is going to drain a little bit of the dorsal venous blood on the foot. We're going to see in a minute that most of that blood actually goes superficial, but a little bit of it will drain into the anterior tibial. And just like the artery, it's going to pass just above the interosseous membrane here between the tibia and fibula to cross to the back, okay? And that's where it meets the posterior tibial vein, and together they form the popliteal vein, okay, which is running with the artery. As we move up beyond the knee, that changes names to the femoral vein, and there we go, femoral vein. We'll follow that up, and then we have a deep femoral vein, just like the artery, that connects to it. And these move kind of anteriorly. Okay, so here's your femoral. It's going to move more anteriorly. There's the deep femoral. And then they're going to cross under the inguinal ligament to become the external iliac vein. Okay, so just the same as the arteries. The differences we see are going to be with the superficial veins. So we mentioned that the dorsal foot veins here are going to mostly not drain into anterior tibial vein. That's because they're going to drain into one of these superficial veins. Here's the name, the great saphenous vein. Okay, very long vein, and it starts down here. Okay, it's going to run anterior to the medial malleolus right there. And it drained a lot of this dorsal surface, superior surface of the foot. It's going to run up along the medial leg, past the knee and medial thigh, and eventually drain into the femoral vein, okay? We are also going to have, here we'll look on this side, a small saphenous vein, which is also very superficial. That's going to drain a bit of the lateral side of the venous network, so this area, okay? And on the, and this area as well, okay? So on the top and bottom. And it's going to run posterior to the lateral malleolus, so that's right here, posterior to the lateral malleolus. So this is the small saphenous vein. Okay, along the lateral side of the leg, and it's going to drain into the popliteal vein, which then turns into the femoral vein, and away up we go. So we're going to keep following that external iliac vein up. And you can hear, I hope you can't hear the kids screaming in the background, sorry. So we'll follow our external iliac vein up. Just like the arteries, it's going to join with an internal iliac vein to form the common iliac vein. And the two common iliac veins, right and left, are going to join to form the inferior vena cava, which will run right next to that abdominal aorta, okay? And your IVC is gonna head right up through the diaphragm and up towards the heart. Now we're going to stay in the abdomen for just a minute. And just like with the arteries, we do have muscular or parietal veins, and you can see them kind of along the side, along the wall here. So those would be draining deoxygenated blood from the muscles in the abdominal wall, and they're all gonna drain back into the inferior vena cava. And then we have our visceral veins, okay, which we'll see on the next slide. So the visceral veins in the abdomen are set up a little bit differently than what we see elsewhere in the body and even what we saw in the arteries, okay? You're gonna see the names are similar, but the setup is quite unique. So here's the deal. When blood vessels like these guys, okay, all these veins that are along the intestines, when they absorb nutrients from the intestines, before we send out that blood and those nutrients out to the heart and then to the rest of the body, we want to check it first. So we want to make sure there's nothing toxic in there and just have a quick filter through it before we send it out on its way. So for that reason, we have what's called the hepatic portal circulation. Hepatic means liver, okay, and the liver in this image is right here. And the liver is a filtration system. So that's where we're going to check through all our blood, okay? So we have a few big veins that are going to do this. The superior mesenteric vein is here, and it's going that direction, okay? And the inferior mesenteric vein is all along here. Okay, there's your spelling, inferior mesenteric and superior mesenteric, okay? The inferior mesenteric vein is going to drain into this guy. He's headed that direction. It's called the splenic vein. There's your spelling. It's called that because it's coming from the spleen over here. The splenic vein right here is going to join with the superior mesenteric vein. So now they're bringing all this blood where they've picked up nutrients from the intestines, and they're going to bring it this way into the hepatic portal vein. Okay, so the splenic vein and the superior mesenteric vein join to form the hepatic portal vein, and that's going to go into the liver. Okay, the liver is going to check all the blood, and then once it's checked, it's going to travel through two hepatic veins, so right and left hepatic vein, into the inferior vena cava, and now we head towards the heart. Okay, so where's my little, there it is. It's hard to find it. So the inferior vena cava picks up this nice, clean, filtered blood from our hepatic veins. It's going to cross the diaphragm and go into the heart. Above the heart, so draining the upper portion of the body, we have branches going into the superior vena cava, okay? So that's here. And we'll talk about draining into the thorax for starters. And then we'll talk about the actual blood vessels that contribute to the SVC in a later slide. So draining the thoracic wall and the organs of the thorax, we have a few major vessels. So the first one is this guy here. It's called the azygous vein. There's your spelling, azygous, okay? And it runs just to the right of the vertebral column along the posterior wall, and it drains into the superior vena cava, okay? And you can see all of these parietal veins or muscular veins draining into the azygous, okay? And you can also see little veins here that are visceral veins also draining into the azygous. Now, on the left side of the vertebral column, we have two more veins that are going to bring blood from the left side of the thoracic wall back to the azygous vein, okay? So they are the hemiazygous, which is here. Okay, there's your spelling, hemiazygous vein, which is at about rib 8 and below. And then the accessory hemiazygous vein, which is here. Okay, accessory hemiazygous. So that's going to drain your veins that are about rib 8, above rib 8, sorry. So you can see them all kind of draining back. Okay, so if we were starting from a muscular branch or a visceral branch at the level of, let's say, the 4th rib, your path of blood would be the parietal branch to the accessory hemiazygous vein. I'm going to do another color so you can kind of follow what I'm doing here. Let's do green. So the parietal branch to the accessory hemiazygous vein, to the azygous vein, to the superior vena cava. Okay, so that would be a pathway for you. All right, we're gonna zoom out a little bit and look at the upper limb. So just like in the lower limb, we're going to have a set of deep veins and a set of superficial veins. And I've split these up onto 2 slides. So we'll start with the superficial, or sometimes they're called cutaneous veins, okay? C-U-T-A-N-E-O-U-S, cutaneous veins. And it just means close to the skin. So cutaneous means skin. So when you look at your arm and you see veins, you're seeing your superficial veins, just like in the lower limb, okay? So we'll start down at the hand. We're looking at the palmar surface of the hand here, so the anterior surface. But we have a very similar structure of veins on the, oh, I don't like this color, sorry, on the posterior or dorsal surface. And it's just a lot of little veins going to the fingers and all over the hand. The veins on the posterior surface and then many on the superior surface, anterior surface, sorry, are draining into a couple of superficial veins. The first is the cephalic vein, okay, and there's your spelling, cephalic. And again, we're in the right upper limb here. So your cephalic vein is running up like this. It's fairly lateral, crosses at the elbow anteriorly, okay? And it's going to run between the deltoid and pectoralis major in this area, okay? So deep to deltoid, superficial to pectoralis major, and then it's going to drain into the axillary vein, which is a deep vein. And just like in the lower limb, the deep veins are going to follow the names of the arteries, okay? And we just have a little bit more on the superficial side that I want to show you. So the cephalic vein is fairly lateral. On the medial side, we have the basilic vein, okay, which is this guy here, basilic vein, okay? And it's traveling along medially, all right? And it's fairly superficial as well. It's also going to empty into the axillary vein eventually. And I'll point out one little connector here, and that's the median cubital vein, only because this is very clinically relevant. So on the anterior surface of your elbow joint, the median cubital vein connects your cephalic vein laterally with the basilic vein medially. And this is a really very, very superficial and good-sized vein, the median cubital, which is why this is where you often have blood taken, because it's nice and superficial, really easy to see, very easy to access with a needle, okay? All right, let's look at the deep veins. So these ones will sound more familiar because they will be following the arteries, okay? So the palmar veins, for the most part, like we said, the veins on the posterior side of the hand drained into the cephalic and basilic veins, so the superficial veins. The palmar veins are going to drain, for the most part, into these deeper veins. So we have radial vein and ulnar vein, okay, just like we had before. They combine to form the brachial vein, which is here, okay? And you can see here the more superficial veins for reference as well. Okay, so your basilic and your cephalic is here, and then median cubicle is there. Okay, so the brachial vein is going up here. It's going to change names to the axillary vein here at the lower border of teres major, just like the artery. And then the axillary vein passes over rib 1 and under the clavicle and becomes the subclavian vein. Okay, so same as the arteries. Okay, so we're going to continue following the subclavian in a minute. Oh, where's my, oh, there it is. So here's the subclavian that we were just following. Okay, so this is rib 1. Okay, so it's the axillary vein, then we pass rib 1, and now it's the subclavian vein. But I want to talk about the drainage from the head before we get really close to the heart. So we mentioned in a previous video when we talked about the meninges of the brain that when the dural folds form, they create little openings for what's called the venous sinuses, and that's where the venous drainage around the brain is. And you can see some of them here. I'm just going to point out a few of the major ones that I want you to know the names of. So the superior sagittal sinus running right along the top of the brain. So these are all inside the skull. Okay, so superior sagittal sinus. There's also an inferior sagittal sinus. Okay, and then that follows the straight sinus and they connect here. And then we have 2 transverse sinuses, kind of one on either side. And these are going to make their way back to the internal jugular vein. Okay, so the internal jugular vein is here. And I'm trying to find spelling for you. There we go, internal jugular. Okay, so your internal jugular, and it's heading down this way. So all of these venous sinus branches are draining the interior of the skull, so the brain and other things on the inside of the skull, and they all bring blood back to the internal jugular vein. Okay, so then if I can erase this, a path of blood might look like this: inferior sagittal sinus to the straight sinus, to the transverse sinus, to the internal jugular vein. Okay. Alternately, if you start with the superior sagittal sinus, you would go from the superior sagittal sinus to the transverse sinus to the inferior jugular vein. Okay, and that's going down towards the heart. Now on the external of the skull, we are going to have a different setup, just like we have with the arteries. So we have, again, a maxillary vein. It runs with the maxillary artery. Okay, and then we'll have a number of veins that drain the face and the scalp, and these are draining into the external. Oh, sorry. Hang on. Sorry, I paused our recording for a minute because a small child ran in the room and I got a little distracted. So I don't trust whatever I just said last. So I'm going to repeat it because now I'm looking at these drawings and I don't know where I was going there. So I apologize, I got distracted. So let's go back to the external of the skull. So I'll just walk again through the paths of the veins to make sure I was clear the first time, because I definitely got distracted near the end there. So we said that the right maxillary vein is going to drain the face and the temporomandibular joint area on the external of the skull. And you can see we have branches then going back over here. This is the external jugular vein, and branches from the skull are also going to head towards the external jugular. Now, a little bit different from the common carotid and the carotid artery branches is that we are going to have some venous drainage on the external of the skull, draining into the internal jugular vein as well, okay? For example, the superficial temporal vein here, which is with the superficial temporal artery, actually drains into the internal jugular vein. Don't worry too much about the detail here. I do want you to know that the superficial temporal vein drains into the internal jugular vein, but more than anything, I just want you to be aware that some of the venous drainage from the external of the skull does go into the internal jugular vein, whereas most of it goes into the external jugular vein, okay? All right, So the external jugular vein is going to drain into the subclavian vein, all right? So your pathway there then would be external jugular vein to the subclavian vein, and then into the brachiocephalic vein, which we'll hit on the next slide. The internal jugular vein is going to come down and join the subclavian vein to form the brachiocephalic vein. Okay, so the internal, I'm going to switch now to this. So the internal jugular vein and the subclavian vein join to form the brachiocephalic vein. And this is actually the same on the right as on the left, okay? With the arteries, it's different on the right and the left, but in the veins, you have the same setup on the right and left. Okay, so here's another view of it. So here's your right internal jugular vein joining with your right subclavian to form the right brachiocephalic vein. And then on the left, we have the left internal jugular vein and the left subclavian vein joining to form the left brachiocephalic vein, okay? And then the right and left brachiocephalic veins, I realize those aren't labeled, so label them now. Right brachiocephalic vein, left brachiocephalic vein, those are going to join to form the superior vena cava, which then drains into the right atrium, okay? And you can see that all the veins up here, the superior vena cava and all of the veins leading into it, that those are anterior to the arch of the aorta and its branches, okay? So when you're looking at images in primal pictures, you'll be able to see the veins closer to the front and the arteries behind. Okay, that's it for us today. I highly encourage you, again, to practice writing or drawing out your pathways to follow the blood. I think that that's a really useful and helpful way to learn all of these structures. In the lab, you'll be practicing identifying some of them, but that'll be more focused on the heart versus the blood vessels themselves. So I certainly recommend that as a study approach. And that's it for us today. So we'll see you next time.